Now let's turn this over and let Monica Hooper react a bit to what I've been saying about both tobacco and colorectal cancer screening. Monica, as you can see and read in your program, is the director of the Office of Cancer Disparities Research at the Case Comprehensive Cancer Center and is a professor at Case Western Reserve School of Medicine. So, Monica, thank you.
Thank you. Can you hear me in the back? Yes, okay, thank you very much. I first would like to thank Dr. Siebel for inviting me here to offer my comments today, and I would like to, of course, congratulate Better Health Partnership on really impressive work. This is really a national model that other cities should seek to replicate. When I first met with Dr. Siebel, when I moved to Cleveland a year ago, and he explained to me about Better Health Partnership, it was impressive then, but to be here today and have a chance to really witness the work that you all have been doing is really impressive. I think, clearly the sharing of data to allow surveillance, tracking, and reporting on important health status measures really also gives us an opportunity to recognize progress, improvements, but also informs us about areas that we need to continue to monitor as we move forward and think about where we might target our prevention and intervention efforts. And clearly, one thing I also really like is the focus on systems level change and provider practice level change rather than solely a focus on what patients need to do better at. So the Office of Cancer Disparities Research is a new effort at the Case Comprehensive Cancer Center, which I'm fortunate to lead. We began just a year ago, and so in June of 2016, and our mission is to really work on reducing and ultimately eliminating the disproportionate burden of cancer in our catchment area, which is sort of the 15 counties around Cuyahoga County, and beyond by promoting a focus on more health disparities focused research and outreach. So I'm excited to see these new data and their incorporation of cancer risk factors, early detection, and screening measures. Clearly, the work of Better Health Partnership is very useful. It's highly relevant for the Cancer Center. There's the excellent focus here on cancer risk factors such as obesity and tobacco use, as well as conditions that we know are caused by tobacco smoking, such as hypertension, and more recently we learned that diabetes can actually be caused by tobacco smoking. So in our catchment area, which is sort of the 15 counties around Cuyahoga, the age-adjusted incidence for all cancer types ranges from below to above the national average, but the highest incidence is in Cuyahoga County. So there are approximately 23,000 new cases of invasive cancer of all cancer types each year in our catchment area, and about almost 8,000 of those cases are within Cuyahoga County residents. And these rates are higher than for the rate of Ohio and for the United States. Like other areas in the nation, colon and rectal cancer are in the top 4 cancers diagnosed in our catchment area. The top is lung cancer, then breast cancer, prostate, and then colorectal cancer, about 9%. However, with the exception of colon rectal cancer, mortality rates in Cuyahoga County actually exceed the national averages. And we know from our local BRFSS data collected by our Prevention Research Center at Case Western Reserve University School of Medicine that Cleveland does suffer from, high obesity rate, so 35% versus 28% nationally. Low rates of adequate fruit and vegetable consumption that really mirror the national average, is about 24% in Cuyahoga and 23% nationally. And we are just 42% of the population reports adequate physical activity versus 51% of the country. We also know that the prevalence of tobacco use in Cleveland, specifically in the city of Cleveland, is double the national average. The national average is more than double. The national average is 15%, and it's 35, almost 36% in the city of Cleveland. And as we saw in the findings just presented, tobacco is a risk factor for not meeting the standards for high blood pressure and for colorectal cancer screening. And the populations that are most at risk for these two areas are those who are the most disenfranchised by economic status, by insurance status, city of residence, race. These are all populations that we know to be, and we describe as our disparity populations and our areas for attention. One of the primary reasons that I decided to join CASE and move to this area was to help address the tobacco use problem, which is not unlike similar cities across the country. But we know from the literature that if tobacco use were addressed, that 70% of all health disparities could be eliminated. So the areas of overlap between the areas of the community that you can see from the maps with high rates of tobacco use and obesity are key when we think about how do we move forward in really addressing, not continuing to document, but really intervening on disparities. Tobacco dependence and obesity are pretty much tied in terms of being our #1 public health problem in the country, and are both chronic conditions, and their synergistic effect is particularly lethal. And there are people who believe, like when they find out that I study tobacco use, who kind of say, well, don't we really know everything there is to know about tobacco use already? We don't. Clearly, there are things that we need to do and things that we need to learn. Communities such as ours really affirms and shows that the disadvantaged communities suffer the greatest burden across the board. We cannot have a healthy community when these two problems abound. Disparities are more than about group and subgroup differences. They really are about social inequities and social justice. But I think this report clearly, it's very important. It highlights important progress. It also gives us a clear foundation for building next steps. One thing I'd also like to mention is the Office of Cancer Disparities is partnered now with the National Cancer Institute on a national initiative to address disparities in colorectal cancer screening called Screen to Save. And the 3 major health systems are collaborating on this effort, and that includes Metro Health, Cleveland Clinic's Taussig Cancer Institute, and University Hospital Seidman Cancer Center. Neon Health and the American Cancer Society are also aligned with us on this effort. And the data presented here really do affirm the need for Screen to Save, especially in our inner city communities, as we seek to educate Hispanics and African Americans on colorectal cancer screening. We're also providing an opportunity for community members to be screened at no cost and assisting them with connecting with medical homes when they need it and being navigated through the complicated health system in the event that cases are identified as positive. So, the needs in Northeast Ohio are great, but they're only surpassed by an opportunity for intervention and better health partnerships, culture of collaboration and sharing, and the mission to improve the health and lives of our residents is unprecedented. And so congratulations, well done.